And welcome back. Endometriosis is a common gynecological disorder affecting approximately 1 in 10 women of a reproductive age, primarily worldwide. And this month, health leaders are raising awareness about the condition. And joining me, gynecological oncologist Michael Finan. Dr. Finan, thank you so much for joining us. It's good to have you again on the show.
Glad to be here. Thank you.
Yeah, and of course it's Endometriosis Awareness Month, and this is a common problem. What should women be aware of, and what are the symptoms to look for?
Well, pain, painful periods, infertility, those are some of the more common things. Unfortunately, the symptoms are so common, and they're also common with a lot of other issues, so it's not always endometriosis.
Right, so it's important to get this checked out and of course get regular checkups, which is always very important. And you're an oncologist, which is a cancer specialist.
Right.
And your specialty is gynecologic oncology. How does this fit into endometriosis?
Good point. So I get involved when the disease is advanced, stage 3 and stage 4. It can start invading into the bladder or invading into the rectum, and the surgery can become very, very difficult and much like cancer surgery. So when it gets to be that far advanced, generally the gynecologist will send the patient to me, and I'll get involved, the colon and rectal surgeon or whoever else needs to be involved as well.
Yeah, and many times this is caught early enough to treat and prevent some pretty serious problems later, especially when you're talking about reproductive years when women may still be wanting to have children.
Right, and there are a lot of conservative treatments available, and I think that's the message here is if you have symptoms, get in to see your gynecologist, because there are things that they can do. They can do laparoscopy to diagnose it. They can treat it laparoscopically, and then there are also some medicines that can treat it to try to preserve fertility.
Sure, and again, early detection is always best.
That's exactly right,
and
yes.
Then you'll end up hopefully with a better outcome that way.
Right, you don't want to see me, that's for sure, but I'm here if they need me, but generally the general gynecologist is the one on the front lines treating this every day.
All right, great. Dr. Michael Finan from Singing River, thank you so much for joining us today.
Thank you.